So if you hold 1 second, okay, our meeting is recording. Can I close this box? Okay. Okay, here we go. So for the content of this presentation, first I wanted to walk you through the resources that we have, what I sent to you as attachments in the email. Then we'll walk through the data entry screen by screen and field by field, talking through the definitions and what all we're looking for. We'll go through how we edit entries, give you a little bit of guidance on population-based versus individual-based guidance on activity entry, and then we'll walk through those new environmental and information dissemination fields. For NPIRS Access, we do require that you have Internet Explorer 8.0 or above. That is a very old version. I think that we're up to like 11 or 12 at this point, so you probably have that. The NPIRS will run on other browsers, but sometimes not super well. So there may be some difficulty in how the drop-down menus appear or how different things appear on the screen. Sometimes you can't even log in. So if you are having difficulties with accessing NPIRS, I would strongly recommend that before you call me or the help desk that you try opening it in Internet Explorer. If you're using Chrome or Firefox or one of the others, just go over to Internet Explorer and see if you can get it to work. NPIRS is an internet-based reporting system and can be accessed at npirs.org. So the resources. So I sent all of these to you except two things, which I'm going to show you on the screen here in just a moment. The prevention definitions basically just walk through what we mean when we say certain words. There's a lot of vocabulary to learn when you first enter the prevention field, and I think it's helpful to have a quick reference guide for what we mean when we say certain things. It's a 2-page document that just runs through the basic definitions. Then there were guidance documents on entering population-based strategies and individual-based strategies. These were new guidance documents that were created last year to help people better understand what we were looking for in entering those strategies, and I strongly recommend that you review those guides before entering any activity into NPIRS. We have a request for approval form. If you wish to enter information about an activity into NPIRS that is not currently on that matrix of activities, you do have to submit a request for approval form in order to get an activity added to NPIRS. That request for approval form asks for things like the name of the activity, whether or not it's evidence-based, who it's targeting, and other such information that helps the division better understand what the program is and whether or not we approve of its use. The matrix of activities is a colorful spreadsheet in Excel that I will show you here in just a moment that helps you categorize and understand which activities are in NPIRS and how to categorize them. And the NPIRS Quick Guide walks through the process of entering activities similar to this PowerPoint. The matrix of activities looks like this. The first category here is education, and it walks through the different activities down the left-hand side. You don't have to worry about these codes. They're for our use. It talks about the evidence, the intervention types, targets, and who that program shows outcomes with. These interventions are color-coded. The dark green are considered evidence-based practices. The lighter green are considered promising practices. The pink either has no evidence that we could find showing outcomes or has poor outcomes associated with it. And this yellowish field is an unspecified or general activity, which basically just means that it's so general that there's no way to really connect evidence back to whether or not it could be truly said as an evidence-based practice or not. As you scroll through, you can see that they are broken down by the 6 federal strategy types, which are in bold here. The NPIRS Quick Guide looks like this. It has screenshots from the NPIRS system that helps you to walk through each field and actually goes in the same order that this PowerPoint will today, and gives you definitions. So it's an easy reference document for entering activities, and if you're brand new to the system, I would recommend using this as a guide the first few times you enter activities to make sure that you understand thoroughly what each field is asking you for and how to enter them appropriately. For those of you who are not brand new to the system and have seen this document before, there is a new addition to this document, which is this section about environmental influencers. And this section about information dissemination, because we have added new data collection fields, there is an addition to the document that shows how to enter those and provides definitions. Okay, so we went through the matrix of activities, which I realize now is hard to say, and we should rename this document. So as I mentioned before, there are groupings across the top here. The far left-hand side is that program and activity. The second set shows the evidence and where we got that evidence from. As some of you may have heard, the NREP system is no longer a functioning system, so a number of our entries point to NREP as the place to establish evidence for a strategy. At this time, I have not had the time or capacity to go through and change these links, but at some point I hope to do that. So just as an FYI to everyone, there are still references to NREP, but NREP is not an existent system anymore. So those links will take you nowhere. And I apologize for that. We are working diligently to try to figure out what our next steps here will be. But if a program is listed as that dark green as an evidence-based practice, and it does refer back to NREP as being the source of that evidence, we are going to continue to acknowledge it as an evidence-based practice until we've had time to thoroughly research those programs and look for another source of information about it. We do know that there are some questionable choices on here, and we do know that at some point in the future, some of these will likely be changing. So we'll probably be changing what is considered an ABP and what it is not at some point, but until SAMHSA issues us further guidance, we are holding off on deciding how we're going to go about making changes. So for right now, pretty much everything is grandfathered in, and if we do make any changes, we'll be sure to let you know what the rationale is for making those changes. And then as I mentioned before, when we actually scrolled through the document, those circled in purple there are the federal strategy types. And then I mentioned the quick guide as we rolled through that. So again, a great reference if you're needing help on anything. So why NPIRS? Why is NPIRS an important system? Why do we need to enter all of our activities into this system? And at the end of the day, it's because we have to give data to our federal and state funders who provide us information, or who provide us funding in exchange for our information. So we need to collect the data, have it entered into a place that we can then pull from, which in our case is the NPIRS system. We then need to be able to run reports that show us what is happening comprehensively across the state. We use that to inform stakeholders and provide further context for the data, and then we take all of that and submit it to SAMHSA. At the bottom here, one thing I just want to emphasize is that we can't do any of this well unless the data that's in the system is accurate. Over the last 4 years that I've been with the division, I've really worked to try to make NPIRS a more intuitive and a better data collection tool, and I hope that some of you have seen the benefits of that who have been in the system for a while. One of our biggest concerns is about the accuracy of the data overall, and we're trying to make changes that will ensure that the data becomes more and more accurate over time. So we really appreciate if you review all of our guidance documents before you put data in, or even periodically when things change. So this would be a good time for our users who have been using the system for a long time. Just review those documents, make sure you understand all of the fields and are entering all of your data accurately. So why is this all so important? So this is one example of why it's all so important. So this is a table from WebEx, which is our block grant reporting system. And what this shows is how we report your strategies. So everyone enters information into NPIRS, and one of the things that we ask you is if this strategy was universal direct, universal indirect, selective, or indicated. And that is then broken down into this table, which we submit to SAMHSA. We get a good amount of our prevention funding from SAMHSA, and we want them to have the most accurate picture possible of what we do here in Nebraska, and this is one of the ways that we reflect what we do. If we don't have accurate information, we often end up with numbers in those gray fields, which is frustrating and confusing. So SAMHSA and we here in the division know that a universal direct activity cannot be population-based. and if you review your definitions, you know that as well. But we often have folks who code universal direct activities as population-based in the NPIRS system, and then we end up with a number in that field that we can't enter. So we have to go back and individually, one by one, go through those activities and make a decision about whether it's coded correctly or incorrectly and how to recode it so that it fits well within this table. So when we talk about focusing on accuracy and when we talk about issuing additional and new guidance, this is why. It's because we're held to a specific standard, and we need to have our data meet that standard as well. So we truly appreciate all of your help in coming to this webinar and hearing about how we're working to improve the system and really thinking through what you can do to help NPIRS be more accurate. So now going into the system. So this is what the NPIRS homepage looks like. You go to npirs.org, you get this home screen, and here in the middle is the login button. You, in theory, could click all of these other things if you wanted to, but I would guess that most people who are accustomed to entering NPIRS just click this right away. The one thing I do want to point out to you here on this home screen is that on the left-hand side there is a contact person. Ron Alai at NPIRS is our help desk for this system, and he is always happy to help, whether that's because you locked yourself out of the system, you need to add a new coalition, you need to do something else, or the program isn't working, there's a glitch in the system, the tab order is incorrect. Ron can help with all of those technical issues that stem from the system. On the TA side of things, if you don't know how to code your program, your regional representative and or myself are always happy to help with those kinds of issues. So he's really there for the technical side. If you're having issues getting into the system or utilizing the system, Ron is wonderful. So then you pull up the login screen. Sorry, I did see a chat. I'm going to pull up that question really quick. And the question was, if we make changes, do we let the users in the regions know? Absolutely. So we do these webinars about once a year, and we typically do them right before an enhancement is pushed out. At least in my time here, I don't think that we have ever pushed out an enhancement without either a webinar to walk through all of the changes or at least an email that details all of the changes in the system. The reason that I made the comment earlier is that I think that sometimes we get into ruts and we miss things, or maybe we sat through the webinar but we forgot and we got back into our old ways. So I'm just pointing out this is an opportunity to be reminded of some of the changes that we've made. Yeah, so to clarify, she said, or he said, I'm not sure who's on the end of that one, that if we make changes to the direct entries, yes. So there is always, at least in my 4 years that I've been here, there is always a webinar that walks through the changes if we make any change at all to the entry field. So if we are going to change anything about data entry specifically, we will always hold a webinar and change the forms that are associated with it, add information to the quick guide, and change all of those documents to reflect those changes. So as far as I know, we don't ever push out data-specific changes without giving you ample opportunity to understand why we did what we did and what those changes will mean. I hope that that answers your question. So for the login screen, everybody has an assigned username and password. If you do lock yourself out, or if you need to add a user, you can contact David DeVries here at the division, or you can contact Ron Alai at NPIRS, and they can help sort that out for you. So you put in your username and password, and you come up to this screen. And most people, I think, who use this typically just click on that far left-hand picture there, the Enter New Program Activity, which will take you to the data entry screen. But there are lots of other things that you can do from this screen, including using the navigation bar. You can go to Data Manager, which will also take you to the data entry screen, and we'll also walk through some of the other options from the screen later on. So you can either click Data Manager or click Enter New Program Activity in order to start your data entry. If you choose to click Data Manager, this is the screen that will pop up, and you want to select Program Activity Entry Form. Then you'll come here where you will click Start in order to start entering your new program activity. There is a section that says that there is a demonstration video. It does not exist, so pretend that part of the text is not there. We are recording this session, and so this will be available, and I'll see if I can get it put on the site. I'm not really sure how that works. So we will try to get it posted, but otherwise it will be sent out to the listserv and you'll have access to it there. So the first thing that you'll have to answer when you start data entry, there will be this program activity ID number, which is generated by the system. You cannot change it. You cannot modify it in any way, but I do recommend that you keep a record of this number in the case that you need to edit the entry or copy it in the future. The date entered auto-populates to the day that it is, and you can change that, though I'm not sure why you would need to, but you can if you need to. The next field is the activity date. There is a small calendar to the right if you'd rather pick that date from a calendar. Otherwise, you can type directly into that field the date that the activity was conducted. I will remind you that per the contracts that we have with providers, the entry of NPIRS activities must be completed 30 days after the activity date. So it certainly behooves you to get that information in as quickly as possible after the activity occurs. And we can audit this. We can look back through the activity records and find out what the gap is between the date it was entered and the activity date, and that's how we find out if data entry is happening in a timely fashion. The activity hours, this should include time for planning, time for commute, and then the actual hours that the activity took place. And it can be entered in quarter of an hour increments. So if something takes you an hour and 15 minutes, you would enter it as 1.25 hours. The evidence-based field is the drop-down with the choices of yes or no. And the intervention type field has the options of universal direct, universal indirect, indicated, and selected. You can use the matrix of activities to help you be reminded of whether or not the activity that you're entering is evidence-based, as there is a -EBP tag on all of the activities in the NPIRS system, but sometimes it's easier just to look back at that matrix and see if it's recorded as dark green or any other color to know if it's an evidence-based practice. The intervention types are also categorized on the matrix of activities. As I'm sure most of you know, but I feel like I should point out anyway, anything with a little downward chevron, little caret there, is a drop-down menu. So that if you click that little drop-down arrow, it opens a menu and you can select from that menu of options. So as you can see here, the target population has a menu of options, the primary priority problem has a menu of options, and then if you look at secondary priority problem, you have a list of options there. So you would scroll through those options and check all that apply. Typically with these drop-down menus, it means you can only choose one option. For the target population, that doesn't happen to be true, as you can select multiple populations, and I'll show you that here. So for target population, you push the drop-down menu, you select the population that you are targeting, and then you select the Add Service Population button, and then it will create this table that has all of the target populations that you've selected in it. So once you add one service population, it'll start to generate this table. You can go back through, you can select another one, click Add Service Population, it will add it to this table. If you inadvertently select something incorrectly, then you can click the Delete button on the right-hand side, which will delete that line from the table. If you select something in the drop-down box, but you don't click Add a Service Population, you'll get an error at the end of the page, and it will tell you that you didn't select a target population. So even if you only have one, you do have to push the Add Service Population for each population, even if it's just one. The primary priority problem is the highest priority concern that your activity addresses. We do find that this can be difficult for people at times. They have problems identifying one substance. So we know that a lot of our programs deal with a lot of substances or alcohol, tobacco, and other drugs in general, which makes answering this question difficult. We acknowledge that. We know that that can be a difficulty. However, our funding is tied to ensuring that all of our programs identify specific substances as the primary target of the funding. So, for instance, if you're using Partnerships for Success grant dollars, then you are going to be addressing underage drinking. Now, we know that there are a lot of other things that often fall within the programs and are also addressed by the PFS funding. However, that funding is specifically tied to underage drinking prevention, so the primary problem that it's addressing will be underage drinking. For block grant funding, we know that any of these would be an appropriate answer for the primary priority problem. So we would expect that you would choose the one that best fits the curriculum or the environmental effort that you're doing. You'll pick the one that is the best fit, and then when we get to the secondary priority problem, you can list anything else that your program addresses. So the secondary priority problem field allows you to add any additional concerns that are targeted by your intervention, and this is a multi-select field, so you can select all that apply. I would encourage you, if your program deals with a large number of substances or a large number of behaviors, that you select general ATOD use and not go through and select every drug option on the list. It helps us on the end of actually sorting through the data to better understand what is being conducted if you just select general rather than selecting everything, because when we analyze the data looking for programs that specifically deal with cocaine use, we would pull this data and say, like, okay, who checked cocaine use as a secondary priority problem? What program was that tied to? Well, if you just went through and checked every substance, your program is going to come up, but if you were really looking at general alcohol, tobacco, and other drugs, and cocaine was just sort of like one drug that was thrown in the background of the curriculum, it might just be sort of incorrect to say that that curriculum really addressed cocaine use. So I hope that makes sense. Really, if they're addressing all chemicals in sort of a comprehensive curriculum, select general ATOD. If they're really digging into cocaine use as one of the outcomes in that curriculum, then we'd want you to check that particular box. If you have any questions about that, please chime in, or you can ask in the chat. This field also has a no selection option. If you do not have another substance or another problem that is being dealt with by your program, you can select no selection and just have a primary priority problem, but the primary priority problem is not a negotiable field. You must enter an answer in that field. Okay. For strategy. So I mentioned before the 6 federal strategy types. They are here. They are listed on your matrix of activities, and they will give you, that document will provide you guidance with how to select this. If you are unaware of what the 6 federal strategies are, you can look for more information on the prevention definitions sheet or talk to your regional prevention coordinator. The next 2 fields are the next field, I suppose, is the method and approach field. And this is a dependent field, which means that the drop-down of choices is limited based on which strategy type you choose. So if you choose education, as I selected in that top screenshot, you can see that the drop-down options are different than in the bottom screenshot, where you see that the strategy that's selected is problem ID and referral, and the methods are different. There are 4 different options there. These methods and approaches, we often get questions about them. Sometimes they don't fit super well with what you're doing. We know that, and we wish we could change them, but these are actually set by the block grant through SAMHSA, and while we have talked to them about TA and about how we might change them to be more inclusive, that has not happened as of yet. So these will remain the same until SAMHSA changes them. So do your best. If you need help in categorizing a method or approach, please feel free to contact your regional prevention coordinator or myself, and we are happy to provide you TA on thinking through what the best category is on that. As I mentioned before, the drop-down list of activities does have a -EBP after a program if we have designated it as an evidence-based program. So this is a helpful cheat if you're not 100% sure if the answer to the question, is this an EBP, is yes or no. You can scroll down, look at the activity field, and if it's listed as the name of the program -EBP, then we have designated it as an evidence-based program, and therefore your answer to the question above should be yes. Again, it's also on the matrix of activities. I mentioned the request for approval form before. This is an overwhelmingly complicated slide that I don't expect you to memorize, but it does exist for your benefit and has been sent out to help you understand kind of what to do in the event that you have never used NPIRS before and you need help entering activities, or you don't find the activity that you're doing on the matrix of activities. So if your activity is on the matrix, then you'll want to ask yourself, is that activity a coalition or a board meeting? If it's not, enter it into NPIRS. You have all the information that you need. It's on the matrix. It's loaded into the system. If for some reason something's on the matrix but is not in the system, contact me. I try very hard to avoid that happening, but it has happened in the past. So you can just send me an email or give me a call, and we can make sure that it gets added. If what you're trying to enter is a coalition or a board meeting, then if that meeting is focused on one of your activities specifically, so let's say that you are doing All-Stars and your coalition met to talk about All-Stars, you'll want to incorporate the time of that meeting into your All-Stars activity record that you made. If it is not particularly focused on any specific activity, then you can enter it as a coalition or board meeting into NPIRS. If your program is not on the matrix of activities, but is a part of a larger program, then you would want to check if that larger program is in NPIRS. If it is, use that. If it's not, or if the activity is not part of a larger program and isn't in NPIRS, then you would want to talk to your funder, so typically that's the region, and you want to make sure that that activity is approved, and if it is, then you will want to submit to us a request for approval form. Looks like we have a question. So entering coalition meetings has been an interesting difficulty. We have never outlawed entering coalition meetings into NPIRS. In fact, it still accounts for about 30% of all NPIRS entries, which is a problem. So we have been more and more strict about what should be entered into NPIRS related to coalition meetings. So Scott's question was if he thought we weren't supposed to enter them at all. And the guidance that we've offered is here on the screen. So if the coalition meeting is specific to a program activity, we're asking that you lump it in to that program activity and not enter it separately as its own activity into NPIRS. If it truly is just a coalition or board meeting that maybe reviews a good number of programs, is not specifically focused on any one thing, you can enter it, but we would be very hesitant to have you entering meetings especially more than once a month. We definitely don't want you entering more than once a month. you should try to lump them together into a single program as much as possible. So if you're having the same meeting every month where you talk about the same programs with the same people, you can go in and edit an entry and just add any new people to that entry like you would do with like All-Stars or any of those other activities that we're going to talk to in a little bit about recurring activities. And coalition meetings should really be lumped under that recurring activity model, where you're not entering that coalition meeting over and over and over and over again, the same meeting that's happening with the same people over again. So when we get to recurring activities, we'll talk a little bit more about that. Okay. And just as a reminder, there is a little microphone on the right-hand side of your screen next to your name under the participants list. And if you wouldn't mind just muting yourself by clicking that little microphone until you have a question, we'd sure appreciate it. So intervening variables, these are things that should be on your work plan. And they are the things that we know research shows increase or decrease the occurrence and magnitude of substance use and risk-related behaviors. So these are the things that are in between something like a child and their childhood and what's happening to them and them engaging in a risk behavior. So these are other things that we can deal with and help manage in order to lower the risk that a behavior will occur. These should be identified in your work plans, and they should be something that you are well aware of. If you do need help identifying these, I would recommend talking to your region. They are a check all that apply. So anything that you can justify as part of your program, you can check on this list. So this is what it looks like when you have a completed target population, strategy, method, and activity. As a reminder, the region and organization are auto-populated, and you can't change those. Those are generated by the system when you get login credentials, and you want to make sure that you save. So that is the first of 3 pages of NPIRS entry. You can get a little pop-up that says that section 1 is saved. Okay, does anyone have any questions at all about section 1? You're welcome to chime in on the phones or on the chat. Okay, hearing no questions, seeing no chat, we'll move on. Page 2 is pretty straightforward. What we're looking for here is the number of people served. So if you do a demonstration in a classroom series, and the first week you have 12 participants, here's what you might put. So you have 3 participants that are male, 9 participants that are female, and these are actual counts. That counts field can be actual or estimated, and we'll get into the expectations around those here in just a moment. If the second week of the program more students are added, you would want to come back in to this program activity ID number and edit these fields to ensure that the correct number of participants is reflected here in the demographics. And we'll talk a little bit more about that when we get to recurring activities. As I mentioned, estimated versus actual. So if you can count the people, we need the actual counts. In any situation in which you have the ability to know how many people were influenced, we would like you to provide us that information. We do know that there are a lot of situations in which you cannot provide an actual count, especially when it comes to things like media campaigns or very large-scale presentations, health fairs, those sorts of things. So we know that those provide barriers and that you will just have to estimate, so just be sure to click down on that field and change it to estimated populations and then give us your best guess. For race categories, they're broken down there on the left, and they're the same as the census race categories. And again, it auto-calculates that percentage for you. You just have to put in the counts. If you have no way of knowing, which is sometimes the case, you can put the total number into unknown. And the same is true for the ethnicity categories. Age is broken down as shown on the screen. And again, you just enter the number for each age group that you have. And we do know that on occasion, even when you can, you know exactly how many people are in your room, you don't always know 100% which age groups they fall into, and sometimes these have to be estimated even if you have actual counts of participants, and that's okay. But just be as close as you can as possible, or ask for that information on your sign-in sheet so that you can be as accurate as possible here in the system. Okay, so that's all for page 2. Pretty straightforward. We're just collecting the demographics of the people we served. And remember to save, and then you'll get this activity submission status, and you'll know that you're saved there. Okay, so the next field that you will be asked to enter is what area is being affected by your strategy. This gets really complicated. There are going to be a number of screens about it. I'm not going to read through them because we're running out of time, but all of this exists in the quick guide and also in the 2 guidance documents about population-based interventions and individual-based interventions on how to enter these activities. You are always welcome to request additional technical assistance from your region or from myself, and we're happy to walk through this with you. So know that I'm going to talk you through what's required in the system, but there is a lot more behind it, and you can refer to those documents for additional information. So if you're serving an entire county or an entire region, you can select that from this drop-down list here at the top where it says no selection. You'll select the county that you're serving, and then it will create this box that you see on the second screenshot where it says county and then Douglas underneath. Should you have selected the wrong county, the wrong region, that sort of thing, you can delete from that box, and then you can continue to select additional counties if you need to, and they will be added to this box, and it will grow as you add additional ones, and then you can delete from your list if you need to. If you're serving a specific zip code, then when you select the county that you're serving, the zip code box will fill with all of the zip codes in that county automatically. And you then have to decide whether or not all of those zip codes meet your needs. So if you served all of the zip codes in that county, then you leave them all there. If you did not, and you only served 1 or 2 zip codes within that county, then you can check the boxes and click the Remove Zip Codes button. And the only zip codes that are saved are the ones that are in the box with a check mark when you save at the end of the page. I know that that's confusing. We've done our best to try to simplify the system as much as we can, and right now that's how the system is structured. So make sure that all the zip codes are correct, remove any zip codes that you don't want there, and then make sure that whatever's left in that box is the zip codes that you want to be associated with your activity and that they have a check mark next to them. Okay, so for physical address, if you did not serve an entire county or an entire zip code, or really if all you did was have an activity that took place at one specific location, then instead of putting in zip codes, you would check this box and just enter the physical address of the place that your activity took place. So if you are doing your activity at a church and you're just serving that church community and you don't necessarily know what zip codes that church pulls from, you could, instead of trying to guess, you could just select this box and then put in the physical address of the church, and that would help us to pinpoint the location of approximately the community that you're serving there. Okay, the next set of fields is related to cost. So in this first gray box, you will put the total cost of the activity, and that is the actual cost that was expended on this iteration of this activity. And then you have to break that cost down by funding source. So in this box, you will click Edit, Delete. It will pull up this box and it will be larger, and you'll be able to select from a drop-down list of funding sources, selecting a funding source to add to the activity. You'll select that. You'll add an amount that that funding source paid for, and then you'll save. You can add as many funding sources as were used for this activity that you are reporting on at that time, or you can just have one. If you need to, you can delete a funding source as well. The costs that are in the amount for each of funding sources total has to match the actual costs that you put in the field up here. The very last field on page 3 is this environmental or community indicators field. This is not typically used for what it says right there. So you can use this field to talk about any other issues that came up. You can talk about factors that affected implementation or participation if you want to. But you can also use it to provide us context for the activity.
I will get insurance. Thank you.
So just as a reminder, if you all could please mute your phone lines while we're doing this. We are recording this webinar, so until you have a question, if you would just please push the microphone button to mute yourself, we'd sure appreciate it. So this field could also be used to provide us the dates of activities. So for instance, if you are doing a recurring activity, if you put in all of the dates that you did that activity with the understanding that if it happened over the course of 8 weeks, then you would probably have 8 dates in this field that were all reflective of that single activity that you did. And again, you get to the end, and you push save at the bottom of the page, and you'll get another pop-up box that's this activity submission status, and you'll be able to finish. It will remind you of your program activity ID number, so if you haven't written that down, you have one last chance to get that information. And then you have the choice to finish, which will take you back to the home screen, or you can start new program activity, and it will take you back to a brand new NPIRS entry on the home screen. All right, questions about entering new activities? All righty, move on to the next thing here. So let's say that you entered an activity and you now need to go back and edit that entry, either because you have more participants or because you entered something incorrectly, or I don't know, you missed a field when you were entering the first time. You'll go into Data Manager and you'll go to the program activity listings. And here at the top, you will enter that program activity ID number that you wrote down when you first did your entry, and you'll search for the program activity ID that you need. It will come up. So let's say that we searched for 9469, then it would come up in this field, and then we can click the View Update button to the left here. If you go back really far in time, before a specific feature existed, you will have to enter that information. So about 2.5 years ago, we added the priority population and secondary priority population fields. If you go back to an entry that was completed 3 years ago, you will have to fill in those blanks because those fields did not exist at the time when that entry was completed. For us moving forward, anything that is entered after the release date of the new information dissemination and environmental questions, which we'll be releasing right after this webinar is over, if you go back in time and you edit an entry that is an information dissemination or an environmental strategy, you will have to answer those questions. So you're sort of grandfathered in for all the old entries that don't currently have that information. It's just auto-populated with zeros, that sort of thing. But if you go back and try to edit it, you will have to give us that old information. That's just how the system works.
If we know Gene would still be doing the primary, well, I feel like Gene above anybody then. Give them any.
Sorry, just one second.
Yeah. And then, and I told her, I go, why does this be 10 minutes?
Okay. So if you're doing a recurring activity, so let's say that you are doing All-Stars and you did this program last year and now you're doing it again this year and it's very similar, same program, same school maybe even. You'll go into that program activity listings again, and you'll look for the activity number of the last time that you did that program. And then, so let's say that we're doing another drug-free dance through the Health Rocks, then we can go back to that entry, and we can find it, and we can click over here and create a copy. What that does is it creates an exact duplicate of the previous entry. So every field will be filled in exactly the way that it was previously, except the activity date will not be pre-populated. So you will have to enter that again. But every other screen, every other field will be the same as it was for the last one. So you will need to go through and make sure that the participants that you update the participants, because you're not, I'm sure, going to have the exact same number of participants with the same demographics. So you want to make sure you update those. And then if the location has changed or if anything else about the program has changed, you'll want to update it. What this feature provides you is the ability to take something that you do over and over again on a regular basis and easily and quickly copy it forward, knowing that a lot of those fields that are on the matrix or the geographic location, those things don't change. So instead of having to put those things in every 6 weeks that you do the Health Rocks program, you can instead copy the Health Rocks program and just update the demographics and the dates. So once you click that create copy, it will be assigned its own program activity ID number. And so you'll want to make sure you write that down as well. And you will have a brand new entry with the same information as the copied entry. You do have to go through each screen, even if you don't want to. Even if there's nothing that's different, you do have to go to the bottom of each page and save. And because you're creating a brand new program activity ID, a brand new entry into the system, you'll have to save at the bottom of each page to add it to the database. So just make sure that you're not inadvertently copying and then just closing out. You need to go through each screen and make sure that they're updated and correct. So reports. I'm going to go through this relatively quickly. I want you to know that these features exist, but I think that you can also play with them a little bit on your own, as I think that most people learn better that way, having the chance to experiment. But I want you to know what's out there first. So if you click reports here and then go down to reports by coalition, I don't know how many of these you can actually see. This is from an administrator level on my end, but somewhere in this reports menu you'll see reports by coalition. And one of those, I'll show you two reports that I think are specifically helpful to your organization. The program activity report, this gives you a list of all of the programs and activities based on the filters that you put on. So if you give a date range, you select your coalition, and then you can select funding sources. You don't actually have to select funding sources if you don't want to. If you want just a list of everything that coalition has done during that date range, you can leave that field blank, and it will just give you everything. Then you push, and you can select multiple by clicking multiple of the funding sources in that box, and then push Run Report. And what it'll come up with is everything that's been entered by you during that time frame. So as you can see, I just did some sample things here. So if you run for the last year by DHHS, I did by all funding sources. And these are the 3 things that I entered in the last year. And if you are an agency who enters data on a regular basis, because you do community-based programming, your list will be much, much longer than mine is, obviously. If you do not keep a running list of your program activity IDs, if you lose a copy of your program activity IDs, something like that, if you're not the person who typically keeps track of them and you need to know what they are, this is the best way to find them. So you can search for the date range and the coalition and the funding source, and it'll pull up that list of program activity ID numbers that you will need in order to get back to those entries. The other report that I think is really helpful for coalitions is the participant report. And this provides you all of the demographic information based on the fields that you select. So choosing the date range here, and then your coalition, the program and activity. So after your coalition is selected, you'll have a list of program activities that you've done, and then you can select from those that you've done to get the demographics served. You'll select the county if you're interested in that, and then funding source. All of these fields can be left blank except the date range and the coalition. So if you want to know just total how many people has your coalition served in a specific date range across all activities, across all funding sources, you don't have to fill in those last 3 fields. But you can use it to narrow down, and I know that some people have used this for grant applications or even just to do quality improvement or quality assurance for their own work. So this is what it looks like when you do filter down, and as you can see, I only had those 3 entries from before, those test entries, and you can see that I had 2 male participants. One of them was 15 to 17, one of them was 21 to 24, both white, one Latino, one not Latino. So it really does just pull all those demographics that you've put in together for you. So we are just about at 2 o'clock, so I'm not going to read these to you, but you will have access to copies of all the slides, and these also exist in guidance documents. So basically, what I just wanted to mention is that for each type of population-based activity, there is a little bit of specific guidance about what to do for countable populations and uncountable populations and how to best estimate those population numbers to then put into NPIRS. And it really does go through each of the possible categories that you might need. If you feel like there is something missing that you use a lot and don't know how to report, please let me know, and I am happy to help you think through how to enter that into NPIRS. So that's for information dissemination and environmental strategies. We do have specific guidance on how to calculate that. And then for those of you who aren't as familiar with census information, if you go to census.gov, you can pull up these quick fact tables, and you can enter your city, county, state, town, zip code even, and then it will pull up the census data for that area. So you can see here in my example, I pulled up Dawes County. You can see the total population there is circled in purple, and then the persons who are female is circled there below in purple. So I do give you the breakdown of how to do the math to then get a population estimate by gender, and you would enter that information into NPIRS based on the census data if you're doing an activity that targets all of Dawes County. Any questions about any of that? Okay, so when we're talking about these individual-based activities that happen over and over again, on the screen is a quote from guidance that we received from SAMHSA. And basically what it is getting at is that we know that we don't have a big brother program that makes sure that every single child is tracked across their lifetime, and we don't know how many times a single child has received a prevention intervention. But what we can do is not duplicate as much as we possibly can in our counts. So we know that if a child lives in Douglas County, for instance, that they are probably going to be counted multiple times because they will be influenced by multiple interventions over time. But we can mitigate some of that impact by not counting them over and over again for the same program. So if we know that they're being counted once for All-Stars, we could avoid counting them 6 more times for All-Stars because we know that they're in that program over and over again. So we want to do our absolute best to not duplicate these counts. So what we want you to do is, if you have a program that recurs over time, that you possibly have an activity that, let's say, runs over an 8-week period, that you would want to enter that activity once and then go in and change the demographics of the participants that are participating in that activity, and not create a new record every time, because that will be duplicating those people. And when I mentioned before about coalition meetings, this is what I was talking about. So we know that the same people tend to come to coalition meetings every week, or every month, or every 6 months, or however often that you have coalition meetings. So we want to not count those people over and over and over again. We want to change the demographics if different and new people come to the meetings, but we don't want to just keep counting the same 10 people who come to the coalition meeting every time they come. I believe that our guidance in the past has been counting coalition meetings once per year is probably the easiest way to do it. So if you create a new entry every January for your coalition meetings, and then every month that you have a meeting, you go in and you update that listing to reflect any new membership or anyone who has come to the meeting that hasn't come in the past. That would then ensure that we don't continuously get duplicate numbers. And that's the guidance that I will continue to give you. I deleted the slide that had the actual breakdown in a pie chart, but we are still contending with the fact that about 30% of all of our entries come from coalition meetings, and that's not very reflective of what we do in the state. It makes it sound like a third of all of the work that we do is coalition meetings, and I don't think that anyone would say that a third of the work that we do is just spent meeting necessarily. So we want our data system to be more reflective of the activities that we do and less reflective of the meetings. We do know that those meetings are important, so we do want you to enter them once a year and continue to update them. I hope that makes sense. Standalone or one-time activities, you'll just enter them every time they happen. And we already went through how those recurring curricula-based activities work. And there is additional information here on those ongoing meetings and activities, as we've talked about. And I apologize, we did say to put those in every 6 months, not once a year. So here at the bottom, you can see that for the block grant, we ask that you enter those coalition meetings in July and January. And for PFS, we ask you to enter those in October and April. So if you are currently entering your coalition meetings every month, we would appreciate if you'd switch to the schedule. If you're not entering them at all, we'd also appreciate you switching to the schedule. Okay. That is the overall demo and all of the information related to how to enter into NPIRS in general. Does anyone have any questions before we get into the new stuff? We do have a question. Do we change the date every time we have a new meeting and add new people? Would that show that we meet only once? So that's a great question, and we're working to resolve that for future enhancements. Right now, what we ask is that you put the first date that you are making that entry into the system, and then that you add the dates in that last field. So every time you go through and do an update, that you would add the next coalition meeting in that open field so that we have a list of all of the dates that you made updates. At some point, we would really like to have an ongoing list or a way to update that. We just don't at the moment. So just ensure that you add those dates into the open field at the end. Any other questions? All right, there will be more time at the end for questions, but we'll go ahead and get into the new stuff. Okay, it's pretty simple and straightforward. I think that this is information that you will all know, but if you do have concerns, we're happy to address them now. There are two sets of new questions. There are environmental and information dissemination questions. So we'll start with environmental. If you choose as your strategy environmental, you will have this box pop up here below intervening variables, and you will be asked these 4 questions. If you answer yes to this first question, which is, did this environmental strategy include training of environmental influencers? So classically, the example would be RBST. So if you are training beverage servers, that is an environmental strategy as it affects the environment of alcohol availability in our state. And so you would push yes. And so then you would be asked what age groups you were targeting. In the example of responsible beverage server training, you'd be targeting youth under the age of 21. So you would check those 3 boxes. So you would check the children, 0 to 11, youth 12 to 17, and young adults 18 to 20, as those are all of the groups under 21 who are influenced by that strategy. And then you would put in this box the number of people who passed and the number of people who failed that training. The total participants box is grayed out and is automatically calculated for you. If you select no, that this was an environmental strategy that was not a training of environmental influencers, you're still asked for that age group question of who you were influencing, and then that first pass-fail question is grayed out. It's a little bit hard to see that it's grayed out, but you can tell that it's a little fuzzy. And the second question opens, and it's the number of checks that were passed or failed. We know that not all environmental strategies that are not trainings they're not all compliance checks, but we do believe that you'll have this information for most of those strategies. So if you do shoulder taps, you'll be able to put it in here as the number of shoulder taps that were completed, how many were passed, how many were failed. I know that that's not the exact language that we use when we talk about shoulder taps, but we were trying to condense this field as much as we possibly could, and we felt that this was the best way to condense that question down. So any environmental strategy that's about enforcement of any kind, that would fall under this category. It's not a training, it's some kind of enforcement effort, and that would be this number of checks here, or number of inspections. We should probably change that, huh? I'm going to have that language changed to inspection. But just know that this field applies to other compliance-related activities, even if the language isn't directly reflective of that. For information dissemination, things are a little bit more complicated. So if you choose strategy, information dissemination, the bottom set of questions is based on the method or approach that you choose and not on the strategy that you choose. And you'll see why here in just a moment. So the first method or approach that you can choose on that drop-down list is brochures, fact sheets, newsletters, and handouts. So if you choose that, then below this will pop up, and you will need to select the age group for which this information dissemination was targeted. And then you will see a number of questions that are grayed out and only one that is bolded, and that's how many brochures, fact sheets, newsletters, handouts, or resources were distributed. And you'll enter that number into that box on the right-hand side. If you choose the second option under Methods and Approach, it's Clearinghouse Information Resource Centers. So then this last bullet is now bolded, and the rest are grayed out, and you'll put in how many people visited, called the resource information hotline, and you'll put the number in that field to the right. And this continues based on what you choose. So in this instance, if you choose health fairs or other health promotions, such as conferences, meetings, or seminars, then these two options will pop up. How many other promotion activities were hosted? How many community meetings did you present at? If you did one and not the other, you can just put 0 in the field that's not applicable. Again, you can see how these line up. Information lines, hotlines was selected, so how many people visited or called. Media campaigns is the big one. So media campaigns is very broad. It could encompass any number of things. So we didn't feel like we could easily limit these fields based on that. So we know that a media campaign could be just TV, it could be just flyers, it could be just posters, or it could be any combination of those things. So what we want you to do here is to record the number of the things you did and put 0 in the places that you didn't do. So if you aired TV ads and if you also handed out flyers, then you would put the number of TV ads in that first box, then you would put zeros all the way down to the brochures, fact sheets, newsletters one, and then you put the number of flyers, and then you put 0 in the last one. So really, you're just filling in the boxes that are applicable to the campaign that you hosted. Looks like we have a question. Okay, so if you, say, passed out flyers at a health fair, then you would select the method or approach that's most like that, you know. So here you would, So if you're passing out flyers, it would most likely be this brochures, fact sheets, newsletters, handouts. If what you're doing there is handing out information, then we'd want to be sure to capture it this way in the brochures, fact sheets one. So you'd be able to put the number in there. If you are presenting at a health fair or at another like health promotion event, then you'd select this one and you put in the number of meetings that you had related to that effort. So if you have a booth, what we want you to do is you can put 1 in this promotional activities if you want, but it's probably better captured under the brochures, fact sheets if you're handing something out. If you have a booth or people are coming up to you and talking to you, if you're providing them information in person, then we definitely want you to put in the health fairs, health promotion thing, because you're actually physically present there and discussing this with people. Okay. So it sounds like that was, yes, you're correct, Michelle. And, okay, the question, will these fields need to be filled out for previous NPIRS entries? So that's a good question. Yes, if you go back into an old entry that was previously entered as an environmental information dissemination, but not if you don't. So we're not asking you to go back and change anything that's already recorded. It will be from the day that this launches live is when we'll ask you to start entering this information. However, if you voluntarily go back into an entry for whatever reason, you will be required to fill this out in order to save. So because of the way that the system works, everything is sort of grandfathered as 0, grandfathered as nothing for the entries that are not currently being accessed. But if you open one, it's going to recognize it as an unfilled field, and it's going to ask you to put it in. We understand that there's a potential that you don't have this information, or you weren't collecting it at the time, or it's been lost, or you're not the person who did it, or whatever. If that's the case and you legitimately do not know how many TV ads were aired, you can put 0 in the field. If you do know the information, especially if it was recent, and you go back into the field, we would like you to fill it out as best you can. But you don't have to go back into anything that you previously entered just to enter this information, only if you are going back in for another reason. I hope that answers your question. Okay, so radio and TV PSAs, and it's pretty straightforward. How many radio and TV ads aired? Resource directories, again, points you down to that brochures, fact sheets, and resources distributed. Speaking engagements. Okay, so that's all of the options under method and approach. So as you select something under that category, it will pop up as related to that. If you feel like you're not getting the field that you think is appropriate, it's possible that you're not choosing the method or approach that's most appropriate to the thing that you're doing. It's also possible that our coding isn't quite right and we need to fix something. So if you feel like you chose something and you can't fill something out, but you think that you should be able to, you can contact us and we can look at this. This is a brand new field that we're obviously launching today, and so there's a very real possibility that something's not coded quite right, and you can let us know about that and we'll get it fixed for you. The other thing that I want to point out about this is that the activities are not related in the backcoding. So you can choose anything in your activity, just like you've always been able to, and it could be unrelated. So in the examples that I've shown you, the activity that's been chosen is fixed display, no matter what I chose in the method and approach. A fixed display is not a resource directory. A fixed display is not a radio or TV PSA. But it is selected. So we would just like to caution you to be careful that you are ensuring that your strategy, method, and activity all match up when you're entering it, because we're not forcing it to match. That's up to you and your judgment call. So we just ask you to really check, make sure that's accurate. I think that I went into enough detail about why accuracy is important earlier, but we do want to make sure that you're not just kind of entering aimlessly, because the method and approach really is backcoded, so you can't put in something that's not tied to your strategy, but the activities aren't a forced choice. So you can pick from anything. So make sure that you're choosing correctly. So that's it. Again, as I said earlier, I think it's pretty straightforward what we're asking. Does anyone have any questions? I think I force muted everyone, so if you do want to talk on the phone, on your participants list on the far right-hand side, there's a little red microphone. You can push it and it will unmute you, and then you can talk on the phone. Otherwise, you can type into the chat box.
Hey, Nikki.
Yes.
Are you guys going to make a new template for the NPIRS like we have?
Yes.
In the past?
Thank you for mentioning that. Okay. I almost forgot to show this. So the NPIRS reporting form, for those of you guys who used it, I did update it, and I'll get that sent out to you. So it now includes the new questions. It was a little bit difficult to find a way to fit them in a way that makes sense. So if you don't like the formatting, let me know, and I can try to change it. I was trying to keep it still all on one page, front and back. So here's what I did. I added this information dissemination question here in the method and approach section. So if you check one of these boxes, then you'll also need to fill out this question here with the asterisk next to it. And then for environmental, the same thing. These questions are listed here underneath. And then, and I just gave really general wording. So how many times were the ads aired or the information disseminated? That question, as you saw on the actual NPIRS screenshots, is very long, and it would have taken like half a page to list it all out. I think that this general wording sort of gets to the same idea, and people will just be able to write like the number of things that were done. And then the target audience question is here. And you only have to answer that if the strategy was information dissemination or environmental. Otherwise, you can skip to the activity. And it is still on 2 pages, but it's getting a little crowded. So I did my best to just keep it to that 1 page. But I will send this to everyone in Word in the case that you want to modify it at all yourselves. But that has been updated. Yes. The slides, I will share the slides with you. I'll share all the forms that are redone with all of you, and I believe I sent the matrix and a number of the other documents out when I sent out the invitation, but I will be sure to send those out again so that you have access to them. Oh. I don't know how to get out of here. Sorry, I am a little bit of a novice at WebEx here, so I'm struggling a little. Okay, other questions, comments, or thoughts? Not hearing any. I will remind you that if you have any system issues, logging in or having the correct organization, associated with your account, you'll want to contact Orion. If you have any programmatic issues, I'm not sure how to enter something, not sure how to categorize something, you'll want to talk to your region or myself. And the quick guide, yes, I will get that sent out as well. It'll come out with all of the documents that I'm going to send, but also I'm going to try to get that posted on the NPIRS home screen, so you'll be able to easily click into that. There's currently a manual on the home screen, but it is outdated at this point now since we're launching these new enhancements, so we'll get that updated so you'll be able to get it on the home screen as well. All right, and if you have anything else at all, please feel free to chime in on the phone or in the chat box. Otherwise, that's all I have for you. All right, thank you all so much for attending and for being such a great audience. If you have any questions at all, please don't hesitate to contact me. My phone number is on the screen, or my email address on the screen, I guess.